Why must I fast for my cholesterol lipid test? Imagine trying to get a clear picture of your health, but recent meals are blurring the view. That's why fasting before a cholesterol test is so important. When you eat, especially foods high in fats or sugars, your blood levels of triglycerides and sometimes low-density lipoprotein cholesterol can spike temporarily. These short-term changes can hide your true baseline levels. Fasting means not eating or drinking anything except water for 9 to 12 hours before your test. This period allows your body to process the last meal and return your blood fats to their normal state. Without fasting, your triglyceride levels might be much higher than they actually are, which can lead to misdiagnosis or unnecessary worry. Triglycerides are a type of fat in your blood that respond quickly to recent meals. Eating can cause triglyceride levels to rise sharply, sometimes doubling or tripling your usual number. This makes it harder for your healthcare provider to determine your true risk for heart disease. On the other hand, low-density lipoprotein cholesterol, often called bad cholesterol, is less affected by recent food intake. Usually, eating before a test changes LDL cholesterol levels by less than 5 milligrams per deciliter, which is a small difference. However, if your triglycerides are already high or you have conditions like diabetes, obesity, or a family history of high triglycerides, fasting becomes even more important. Accurate triglyceride measurement is essential for proper diagnosis and treatment. If your triglycerides are high, you might be at increased risk for heart problems or pancreatitis, a serious inflammation of the pancreas. In recent years, some guidelines have changed. For routine cholesterol checks, fasting is sometimes not necessary, especially if your main concern is LDL cholesterol or total cholesterol. Non-fasting tests are easier and more comfortable, and they still give useful information for most people. But if your doctor is specifically checking triglycerides or monitoring high triglyceride levels, fasting remains the best way to get precise results. So, always follow your healthcare provider's instructions. Fasting helps ensure your test results reflected your usual blood fats, not just a temporary spike after a meal. This way, your doctor can make the most accurate assessment of your heart health and determine the best next steps for you.